It can happen to anyone, and it happens to everyone at some point. That nervous feeling that comes with a racing heartbeat, sweating, rapid breathing, and sometimes even trembling or shaking. It can make you feel sick, and even as though there is impending doom. Anxiety. On any given day, there's a pretty good chance that you'll feel anxious about one thing or another. Experiencing occasional anxiety is a normal part of life. Usually, it's the body's natural response to something that we need to manage. It alerts us and helps us plan and stay safe. But when anxiety becomes excessive and your uneasiness doesn't return to normal after that unfamiliar or threatening situation ends, anxiety can be serious or turn into a disorder if it lasts for a long time. These feelings of anxiety can be upsetting, difficult to manage, and literally make us worried sick. They can make daily life a real challenge. In this Caregivers Care Port episode, we'll learn about anxiety's emotional and physical symptoms and how they can affect you and the person you care for. We'll explore what puts you at risk, how you can protect yourself and your loved one, and what you can do to get relief if you experience symptoms of anxiety. This is Dr. Corabelle Arps for the Caregivers Care Port. We all have some experience with anxiety, and we have a pretty good idea of how it affects us, or maybe you've seen it affecting other people that you know well or other relatives. So you do have an idea of what anxiety is, but most people don't really know how much of an impact anxiety can have, not only on their mental health, but their physical health. And caregivers are really at risk and tend to suffer quite a bit from anxiety. So let's see what we can do to help ourselves feel better and manage anxiety when it does come up. So let's start out by talking about what anxiety looks and feels like and some of the different forms it can take. There are several different types of anxiety disorders. And examples include the most common type, which is just called generalized anxiety disorder, which includes persistent and excessive anxiety and worrying about activities or events, even ordinary routine issues. The worry is out of proportion to the actual circumstance, is difficult to control, and affects how you feel physically. It often occurs along with other anxiety disorders or depression. In fact, depression and anxiety often run together. Generalized anxiety disorder is characterized by physical and psychological symptoms. The physical symptoms include heart palpitations, rapid heartbeat, muscle aches or tension, shortness of breath, chest pains, churning of the stomach, fatigue, headaches, even a choking sensation or a lump in the throat. A person with a lot of anxiety may experience numbness and tingling, weakness, yawning, chronic pain, especially back pain or headaches, dizziness or lightheadedness, trembling, irritability, being easily startled. They may even have irritable bowel syndrome, diarrhea, and or nausea, and problems falling asleep or staying asleep. The psychological symptoms include ongoing disproportionate worry or obsession about things, feeling on edge, a general sense of impending doom for oneself or one's family's safety, an inability to stop worrying. Oftentimes there's just a rumination on troublesome thoughts or how things could go wrong or the way things will never work out. The person may have a problem relaxing and a lack of ability to focus on things and get things done. there's often a fear of making bad decisions, a lack of uncertainty causing distress. And those two things, the fear of making bad decisions and the lack of certainty, which just causes distress, I often see with caregivers who are trying to make big decisions about care on behalf of their loved one. And they may also have difficulty focusing on just negative outcomes when considering their options. Now, this is a really long list, and I don't want this to just be like a lecture, but even this list is not comprehensive, and not all the signs and symptoms are present in all caregivers with anxiety. But when anxiety truly becomes a disorder, there will be many of the symptoms present, and they will cause a real disruption in the person's ability to function well. Frequently, anxiety disorder involves repeated episodes of sudden feelings of intense anxiety and fear or terror that reach a peak within minutes. These episodes are called panic attacks. They're very uncomfortable. You may have feelings of impending doom, shortness of breath, chest pain, or a rapid fluttering of the heart or heart palpitations. These panic attacks may lead to worrying about having another one, so that the person might even avoid situations in which they've occurred in the past because of fear that they'll have another one. Sometimes these panic attacks are so uncomfortable that they even mimic symptoms of having a heart attack. And oftentimes people will go to the emergency room thinking that they're having a heart attack when actually their symptoms are being caused by their panic. Another type of anxiety disorders are phobias, and they involve high levels of anxiety, fear, and avoidance of situations such as social situations, or they may be major anxiety when exposed to a specific object. An example of a phobia would be, say, a social phobia, where the person avoids social situations due to feelings of embarrassment, self-consciousness, and concern about being judged or viewed negatively by others. Anxiety may also be due to a physical health problem. Now, examples of medical problems that can be linked to anxiety include heart disease, diabetes, thyroid problems, respiratory disorders such as COPD and asthma, chronic pain or irritable bowel syndrome, and rare tumors that produce certain fight or flight hormones. There can also be substance-induced anxiety, which is characterized by symptoms of intense anxiety or panic that are a direct result of misusing drugs, taking certain medications, or being exposed to a toxic substance, or withdrawal from drugs. There are a number of risk factors which have been identified, and these are so important for us to know, especially for caregivers to know, because caregivers are exposed to many of these risk factors. So it's good to just be aware of it and be able to, discern what's happening in your own life and with your own emotions. So the risk factors that have been identified include the level of stress burden that you bear. A big event or a buildup of smaller, stressful life situations may trigger excessive anxiety. For example, becoming a caregiver and the ongoing stress of prolonged caregiving, illness or a death in the family, work stress, or ongoing worry about finances, or a combination of many things can be a definite risk factor. Stress due to an illness is also a risk. Having a health condition or serious illness can cause significant worry about issues such as your treatment and your future. Also, people who have endured abuse or trauma or witnessed traumatic events are at higher risk of developing an anxiety disorder at some point in life. Adults who experience a traumatic event can also develop anxiety disorders such as PTSD. There is some indication that personality plays a role in it. People with certain personality types, such as having a more timid or overly cautious disposition, are more prone to anxiety than others. Also, if you have another mental health disorder, such as depression, often anxiety will run and be more of a risk when you have those other disorders. If you have blood relatives with an anxiety disorder, that also puts you at higher risk because anxiety disorders can run in families. Also, drugs or alcohol use or misuse or withdrawal can cause or worsen anxiety. For caregivers in particular, increased anxiety is related to stress, the level of self-care that they engage in, and the size of the burden of their caregiving role. Many caregivers do not seek out support for managing anxiety, and this self-care support is essential for improving your well-being. Caregivers often address the needs of their loved ones with little or no attention paid to their own needs. Ideally, we want to prevent getting anxiety or treat it effectively if it is already present. In an article published in 2019 in the Journal of Hospice and Palliative Nursing, Karen Moss and others addressed family caregiver anxiety. And in particular, they explored family caregivers of persons with cancer. They concluded that preventing and or managing anxiety should include interventions that address 4 dimensions of caregiver quality of life. And these included physical, psychological, social, and spiritual well-being. Taking care of your physical health while caregiving is crucial, and links have now been shown between anxiety and debilitating, life-threatening health conditions, meaning that the anxiety can actually cause other health problems. For example, it's now been shown that people with anxiety disorder were twice as likely to have a heart attack than those without anxiety. Now, that's motivation for treating anxiety. So seeking treatment for anxiety can do more than save your brain. It can save your life. So what can you do to get relief from your anxiety? Well, the first step is to take a second and just observe what's going on with your body. Think about what you are experiencing and whether it relates to a feeling of emotional upset or maybe a reaction to something alarming or stressful. If your symptoms followed a stressful event or period of time that was stressful, it's possible these emotions triggered your symptoms. Also, be alert to signs that you are tensing your muscles, which can also point to a stress reaction and anxiety. Then, if you're having any physical symptoms, get checked out by your primary care provider to determine if a medical condition is the cause of your anxiety. See, this is where it gets kind of tricky because there's a difference between anxiety that triggers physical symptoms and physical symptoms that trigger anxiety. It's important to know if your physical symptoms are a result of your anxiety or if you have anxiety because of a physical problem. For example, people who are having an asthma attack and having trouble breathing will likely feel anxious, but anxiety is not causing their shortness of breath. If you have a physical problem that doesn't get better with relaxation or other techniques, contact your provider and get it checked out. Also, if you're having physical symptoms accompanying anxiety, it can just be a start of a vicious cycle where the anxiety and stress themselves cause the physical symptoms. And then you react with more worrying to those those physical symptoms and your anxiety just increase, and it's just kind of a downward spiral. Or maybe I should say it's an upward spiral of anxiety. So I just encourage you to get appropriate treatment for whatever is the root cause of your symptoms.